Hello, welcome to You and Your Young Child, a program devoted to early childhood and families with young children. I'm Sheila Biggs. I'm a former county commissioner and a retired registered nurse. Spent my career as a maternal child health nurse. One of my stops in my career was at the Dickinson County Health Department. I had the pleasure and the privilege to work with my guest today, Jean Dietrich. Hi, Jean.
Hi, it's really nice to be here. Thanks for inviting me.
Oh, you're welcome. Yeah. You are the WIC nurse.
I am.
Can you tell us what WIC is?
Sure. For many people, when they see me, they think about the WIC program because that's what the majority of my duties are at the health department, although I do a lot of other things as well.
Yes, you do.
But WIC stands for Women, Infant, and Children.
Okay.
And it's a nutrition program that is funded mostly by the United States Department of Agriculture. They also have some formula rebate money that kicks into that, but there are no state dollars that go into that pot of money, okay? WIC provides nutrition and health education, healthy foods and services to Kansas families to try to keep them healthy. That's our goal. And we're so excited to be in Dickinson County, even though we've been here for many, many years. But to continue that service.
1988.
That's right. Actually, WIC started here in Dickinson County back in 1985. Okay. It's birthday year for WIC.
All right.
We are celebrating 40 years of strengthening families through WIC.
Very good.
So WIC was started by USDA in the state of Kentucky back in 1974. People in the government positions became very, very concerned about unhealthy outcomes of pregnancies, the unhealthy state of infants and children, pregnant women in the state of Kentucky. Okay, so they started doing studies and such and determined that supplemental foods could help remedy some of these outcomes that were unhealthy. Okay. So that was the start of WIC. And it grew and grew slowly like many programs do. And then by '85, it hit Dickinson County. Okay. The service was provided by Saline County at that time. All right. And now we're a standalone agency. Yes. So that's great.
That's good. You talk about foods. So that's part of the program is providing I know what we used to refer to as vouchers, and is it still referred to vouchers?
It is not. It is now WIC checks.
WIC checks,
yes. Okay. And WIC checks are for specific nutritious foods, and that's one huge difference between cash assistance, or what we used to call as food stamps. Yes. Okay. WIC is for only specific foods. Okay. Food packages are put together by the state dietitians at the state WIC office. Okay. And it's really a prescription for that particular category of people. Okay. For example, a pregnant woman's food package is going to be very specific for pregnant women and is going to contain more food than, for example, a child between ages 1 to 5. Okay. Okay. Not only does WIC provide the WIC checks, but also specific nutrition education, helping people to problem solve how they can get one step closer to being healthier. Okay. And another thing that we do that is very important is referrals to other services. That may be as simple as checking their immunization record and saying, hey, your child's behind, let's go ahead and set up an appointment just down the hall. Or if you prefer to get that elsewhere, just an encouragement to do that. But we also refer to parents as teachers, early Head Start, many of the multitude of programs that we have in Dickinson counties to strengthen our families. Yes. Yeah.
Very good. So, how does a person sign up for WIC?
Good question. Yeah. Okay. Best way is just to call us at the health department. Okay. And when they do call in, they're going to be greeted by our clerks. At the phone, and I've just got to put a shout out to our amazing team at the health department because WIC is not just me. WIC is all the people that are trained in WIC. So we have a couple of clerks, and we have our office manager who does administrative things with WIC. There is another nurse that is trained with WIC. So for example, if I am sick or if I'm on vacation, WIC services can continue. We have a contract dietitian who comes in monthly, and so it's a great team of people. But when they call in, typically the clerks will greet them, and all they have to do is say, I'd like to sign up for WIC, and they will be made an appointment, and paperwork will either be available for them to pick up or be mailed out to them. They'll be required to bring in proof of identity for themselves and identity for their infant or child, if that applies. Another requirement is that they bring in proof of where they live. They don't have to live in Dickinson County. For example, we serve people who live in Geary County, for example, but they work over here, and so it's much more convenient. Or they live in Saline County, but again, they either like us a whole lot, or it's just more convenient.
For whatever reason, they prefer to come to your office. And
then the other thing they need to bring is proof of household income. Because WIC is income based. So just to give you an example, WIC has a wonderful website, and there is a income guideline on there that people can go to. And a great link for families.
Very good. And I know that since this is a federally funded program, it's not a bottomless bucket.
That is correct. That's correct.
So how many families are you authorized to serve in Dickinson County?
We are authorized for this new grant period, which started October 1st. It's approximately 360 clients. And it's always by participants, not by family numbers. So if it's a family because you serve up to age 5, correct? So if it may be a pregnant woman and 2 other children, so that would be 3 participants.
3 participants. When the baby is born, it's 4. If that oldest child has not turned 5 yet.
That's correct.
So not necessarily families, but participants.
But for example, if our caseload happens to be above that, what the state does is look at the caseload of the entire state. Like we may be over a little bit, but perhaps McPherson County is low, and that averages it out.
So you can go over that number. So do you ever have a waiting list to be on WIC?
We haven't had a waiting list for many years.
For many years.
And we do have slots available. So if there are people that are hearing about WIC maybe for the first time, or are just learning about it again, because many people have seen the little labels at the grocery stores that say WIC approved and don't quite understand what that means.
What that means. It's an acronym that we go, WIC? What is that?
Sure. Call in and find out if you're eligible. We'd be glad to help you. And Jean, just one more little question is, what all happens in a WIC appointment? Oh, good question.
Because too, people kind of wonder, what all happens and how long will it take?
I am going to base this on a new family with 1 participant. So this 2-year-old child, for example. So like I said, they're going to have to bring in proof of ID for themselves, the child, the income, and the address. And then they're also going to have to fill out a diet questionnaire for that child. And it's specific questions that help us as the nurses to ask more questions, or direct discussion, or ask, how are you feeling about this, or do you need some tips to maybe help this child go into a different direction? So when they come back, I'm going to do a height and a weight on the child, and also going to have to do a finger poke, because we monitor hemoglobin levels, to make sure the child is not low in hemoglobin, iron. And then everything is computerized nowadays, of course. And so I always call it playing 20 questions, but sometimes it seems like playing 75 questions. So there's a lot of questioning and answering and filling out the blanks, and jumping through some hoops. Because WIC, because it's a USDA program, does collect data for CDC, Centers of Disease Control. So we're asking some of those questions for that organization as well. But my goal is to make it very stress-free, very friendly, very warm, and very supportive.
Very good. And the information is at the bottom of your screen. Lots of good information, Jean. Thank you very much for coming.
You're welcome. Thanks for having me.